Chris, we've assembled a roundtable for you to break down President Obama's bipartisan health care summit and to help determine just where health care is headed from here. Joining me now, Democratic health care consultant Chris Jennings. He's president of Jennings Policy Strategies and a former senior health care advisor to President Clinton. And we're also joined by McClellan. He's director of the Engleberg Center for Healthcare Reform at the Brookings Institution, and he served in the Bush administration as both FDA chief and head of the Centers for Medicare and Medicaid Services. Good morning to both of you gentlemen. We've got a bipartisan panel here, a bipartisan summit yesterday, but the conclusion seems to be that what came out of that summit is going to be along partisan lines. Is that your takeaway, Mark?
It looks that way. There really isn't a clear path forward for even the limited areas of agreement that were discussed at the summit yesterday to move forward. There's a limited amount of time until the election. There's some statements from Senator Reid and others after the meeting yesterday that suggest there's going to be a real push to try to get the legislation through with Democratic votes. And you can view the proposal that President Obama made at the beginning of the week as one designed to try to maximize Democratic support. Now, that may not be the end of the process, and we're always hopeful for a bipartisan way forward, but I think we're looking at some partisanship for the next few weeks at least.
Chris, what kind of room is there to maneuver, to get this back on perhaps a two-track bipartisan effort?
Well, I think that what became clear yesterday, that the two sides may be so far apart that you are close to having to make a judgment of either trying that approach and getting nothing or going ahead and seeing if you can get a Democratic-only approach. And I think, you know, there is a consequence, this very serious consequence for letting another year go by and not addressing these issues in terms of higher premiums and higher costs and more problems with the Medicare program. And I think the president is making a judgment on both a policy grounds and a political one that he can't afford not to move ahead on this agenda.
Well, in listening into that summit, it was a long, very much broadcast conversation that was held over a number of hours. What seemed to be up for debate is to what degree it's going to be incremental, to what degree it's going to be full force in terms of making any kind of reform here. Why was that so focused on? Why weren't we talking more about the specifics of, you know, what the exact cost increase may or may not be? Why were we so focused on piecemeal or whole pie?
Well, if I may, I would just say that I think it's become clear in this debate that if you really want to address some of the issues that all sides say they care about, whether it's insurance reforms or cost or coverage, that piecemeal approaches, incremental approaches, if you will, actually do nothing more than squeeze one side of the balloon and pushes out someplace else. For example, you really can't do insurance reforms if you don't do coverage. You can't really do cost containment if you don't get everyone in the system to stop the cost shifting from the uninsured to the insured. You really can't do prevention and chronic care management that we all say is necessary if people come in and out of coverage. So I think, and I thought there was a little bit of substantive agreement amongst Democrats and Republicans that piecemeal approaches actually don't address the problem well. Now, I think there's big philosophical differences about how best to do that type of integrated approach, but I guess I thought that was a constructive outcome of the meeting yesterday.
I agree. There's no question that both sides believe that our health system needs significant reforms in order to work better for all Americans. I think the problem is that because we're talking about large reforms here, there just is a different vision on many core elements of the proposal. That's right. So things like how much of the cost of paying, how high should the cost of paying for this be? How much emphasis should there be on steps to reduce costs in the short term? How much in the way of new tax revenues to pay for it? And there are just some big differences remaining there.